Gentlemen, may we now invite Yang Muhammad Datuk Seri to sign the plaque marking the official opening of the IJN Cardiovascular Risk Reduction Clinic.
Datuk Seri, mengenai RU perubatan yang diluluskan di luar raya last week, bila dijangka mungkin akan dilaksanakan?
Dilaksanakan hanya kalau pertama-tamanya diluluskan oleh Dewan Negara. That will be a hurdle to overcome, and saya akan bersama dengan timbalan saya akan membentangkannya minggu ini maksudnya, and that having done that, then we would really told my PUU penasihat undang-undang to see to it that it gets soon as he could. We would Datuk DG pun be reminded that we want to get it done, because as you very well know, there are outstanding issues of the graduates that have the 4 graduates, and also those 4 kelulusan yang belum dalam jadual 4 lagi, itu pun memerlukan redressing ataupun kemasukan dalam jadual 4. So we have to immediately get this going and into action lah, ya. Tapi apa pun dia menunggu Dewan Negara, which is coming. Dewan Negara bersidang untuk 8 hari. So insyaAllah pray and wish as well that we get it through in Dewan Negara.
Dalam tahun ini tu sih?
Of course, this in this sitting.
No, ada implementation.
I would be practical and honest about this. My PUU immediately told me that she wants to get it done as soon as. So I dare not give any promise in this, but that is something yang kita nak lakukan dalam waktu yang segera dalam waktu terdekat. That's as much as I could say. Bila tu, as soon as we could get an idea of what the timeline would be, kita akan memberikan heads up to our media.
Last week in Parliament, you said the Health Ministry is considering the National Health Fund for the funding of public healthcare services. I just want to know, is there any update or discussion going on with the Cabinet?
As I've told you in the Parliament as well, that question coming prematurely before the launching of our health financing transformation by our Health Transformation Office. So I would not be able to expound and articulate the entire health financing transformation. And the mention of the National Health Trust Fund would have to be just a mention without me the opportunity to articulate and enumerate what the mechanics of doing it and establishing it. But I think you surely would understand that I have got to present the entire thing of health financing transformation to get a wholesome, end-to-end kind of understanding of this. But be that as it may, we already are engaging all important stakeholders like our Ministry of Finance, MK2, Bank Negara, the EPF, and even the private sectors, even the bursas. We have been engaging very intensely, making them understand where we're coming from, that the National Health Trust Fund is actually beyond just what is from the consolidated fund or the tax sources, mobilizing other sources of funding as well. So that is as much as I could say. That would be, at the end of the day, to plug all the inefficient spending, as I mentioned, particularly on OOP. Remember, out-of-pocket expenditure is high. But beyond that as well, is mobilizing all the entire sources of funding for healthcare expenditure. So be a little bit more patient for you to get the entire, I wouldn't say blueprint, if talking about blueprint, the whole idea. Simply put, the whole idea will come.
Thank you.
Very soon. Thank you.